All right. All right. Good morning, everyone. I hope you're having a great start to your day. I want to thank everyone for joining us today for this session talking about Medicare supplement plans and, more importantly, growing your income with those Medicare supplement plans. We're going to give it just a few minutes. I've got a lot of folks dialing in at the last second, so we'll let that happen. While that occurs, we'll go ahead and address a couple of things. One, for those of you that are new on our website, the way we do things here is everyone stays on mute. As you have questions throughout the presentation, type those into the chat box, and then at the end of the session, we'll read those out for everyone's benefit and then answer those for you. In addition to that, there'll be contact information at the end, so you can reach out to us here. If you don't want to ask your question in the chat box for everybody and have it read out, you can reach out to us after the fact. But I'm still a few people logging in, but I believe in punctuality, so we're going to go ahead and get started. Today's session is called Grow Your Profit Supplements. We've got a lot to and do very little Medicare supplement, and I've actually had agents say that, you know what, I don't supplement because I'm really kind of uncomfortable how that all fits together. So part of today's session is going to be tying all that in. But for those of you that do quite a bit of Medicare supplements, we're going to talk why you should do certain Medicare supplements, especially with us, and some of that as well. So to help. So with that being said, and without further ado, let's go ahead and get started. So hang on just a second here. I had somebody talking about the sound is cutting out a little bit, so hopefully that's clearing up. Okay, says it's cutting out quite. Tell you what, let's just wait 1 second, and we're going to shift the what we're using for sound, and hopefully fix that up for us. The last thing we want to do is have problems with the sound. Actually, be a good opportunity to let folks continue to log in that are in the process of doing so. So we'll get started here in just a second. Sound now. All right, we're going to go ahead and get going now. I've got a new speaker going, so hopefully that'll help solve apparently some of the cutout problem. I don't know if the headset I was using was a problem, but we're going to get started. And again, we're going to talk a little bit about several things today. We're going to start off with basics. You know, what is a Medicare supplement? And quite simply, most of you know this, some of you may not. Medicare supplement is simply a product that it's a health insurance product for folks that are on Medicare, and it's designed to supplement original Medicare A and B. It's essentially designed to fill those gaps left by original Medicare A and B. Insurance companies selling those Medicare supplements, they are required to offer what's called standardized plans. Prior to the 90s, it was kind of a wild west of Medicare supplement plans. Everybody kind of had their own plan designs and all this, that, and the other. So then they shifted it to what's called standardized plans, and that's what we have now today. And those plans are identified by letters A through N. However, when you look at it, you'll notice some of the letters of the alphabet are missing, and that is because some of those plans were discontinued. So we'll talk a little bit about that. And real briefly, what those plans look like is right here. I know that this page is not always easy to see because it's it's actually just a screenshot from the Choosing a Medigap book. However, if you'll go down to your handouts below, there is a copy of the 2022 Medigap plan book. The 2023 have not gotten my copy of that yet, but the 2022, all the facts are still there. The great thing about Medicare supplement is it really doesn't change a whole lot as far as the basics. So that guide will give you pretty much everything you everyone know about Medicare supplement. It's produced by CMS, and so it is the authority on Medicare supplements. And so these are the current plans. You've got A, B, C, D, F, G, K, L, M, and N. Now there's an asterisk by Plan F because simply Plan F is no longer available for those that are aging into Medicare as of January 1st, 2020. It's still available for those who aged into Medicare prior to January 1st, 2020. So that's kind of a weird one. You'll see Plan F out there, but if you've got, you know, those folks that's aged in since January of 2020, that plan is not available to them. Those are the plans. You can see what they cover. I won't go into great detail on that other than to say that for the longest time, Plan F was the most popular. You can see why. Pretty much covers everything Medicare A and B does not. Since that's no longer available for new to Medicare folks, Plan G has migrated to the more popular plan. Again, you can see why. It covers everything that Medicare Part A and B doesn't, except for Part B. And that is kind of the kicker to why Plan F had to go away, because essentially the system, the CMS and the powers that be do not want 100% coverage availability, because that leads to 100% utilization. So trying to do away with 100% coverage, and so they've done that now for anybody that's aged in past January 1st, 2020. But Plan G is still very robust. The only thing it does not pay for is your Part B deductible. So that's not really that big of a deal for folks, and that's now the more popular plan, followed closely by Plan you can see on the chart, or if you're looking at the book that I attached. Plan N, much like Plan G, covers everything except for the Part B deductible, the Part B excess, and it has a copay. That's what those three little asterisks are, a copay at the doctor. So that plan is becoming very, very popular, and the reason is when you do the numbers, math between Plan G and Plan N, what you would be out of pocket in copay, you're way better off annually on a financial, looking at it from a financial standpoint, in most cases, to go Plan N. So that plan is starting to become more popular. It is a bit more complicated to explain, so that's why a lot of folks still go to Plan G, because it's real simple. But I encourage you, if you're not looking at Plan N now, to start doing so, because that plan is very popular. And I'm going to show you some statistics here in a little while that might open your eyes to why you ought to be offering that plan. So when we talk about what Medicare supplements are, again, it's essentially an insurance policy that pays out-of-pocket copay on A and B of Medicare. Essentially what it is. It goes right along with it. When you go to the provider, you use your red, white, and blue card and your supplement card, and in most cases, you owe little to nothing at that service. Nothing in the hospital, doctor, whether it be your Part B deductible. But because it's an insurance policy, unlike Medicare Advantage, which a lot of you do, which is Medicare Advantage is a part of Medicare, it's Part C of Medicare, whereas Medicare Supplement is an insurance policy that supplements Medicare. So because of that, there is this thing called underwriting. And that scares a lot of people if you've never really sold these kind of policies before, because you think, well, you know, Medicare population, they got a bunch of health issues, they're probably going to struggle with underwriting. And I'm here to tell you that's really not the case. We issue the vast majority of what's submitted. So underwriting is not as challenging as you may think it is. However, it is still a thing to be aware of. So that opens up some opportunities when you're looking at it. When is the best time to purchase a Medicare supplement? Well, if you're new to Medicare, the best time to purchase is right when you turn 65, because you get this thing called an open enrollment. Now, again, some of you are mainly Medicare Advantage agents, so I don't want you getting confused. I know that the federal government they try to make everything easy, so they name everything the same thing, because they figure, well, what's easier than naming everything the same thing? So obviously I'm saying that in jest, because we do have an OEP in Medicare Advantage, which is completely different than the OEP with Medicare supplements. Because again, supplements are an insurance policy, but there is an open enrollment period for that. And that open enrollment period it lasts for 6 months. It's right when you first turn 65 or on Part B of Medicare. So it's really kind of tied. Most people pick up Part B when they turn 65, but really it's tied to your Part B effective date. So once that happens, it's a 6-month window, starts the first day of the month that you are 65 or older and on Part B of Medicare, and it lasts for 6 months. During that time frame, you do not answer any health questions. When you look at an application, it'll ask, are you applying under open enrollment? If you say yes, it tells you right there on the app to skip the health questions, because you don't answer those. It does allow for a pre-existing waiting period to be assessed. However, most companies do not assess that. And if you have credible coverage, in other words, you're coming off a group plan, other health insurance, whatever it is, then that's waived anyway. But that's what the open enrollment period is. That's when to purchase the product is, because you don't have to answer the health insurance questions. However, unlike Part C of Medicare, which is not an insurance policy, it's a part of Medicare, a Medicare supplement allows you to purchase the plan anytime. It's just an insurance plan. You can apply for it anytime. You just have to fill out the health questions unless you're applying under open enrollment or some other guarantee issue option. And there are a few of those, and you'll find that in that book that I've attached to the handouts. Typically, depending on which version of the Medigap, choosing the Medigap guide you're looking at, that guarantee issue chart hovers around page 20 to 21 to 22, somewhere in there. It moves year over year, but it's always right in that area. So some of those that you'll find in that chart, again, it's right there in that guide. Some of those reasons that you would have guarantee issues, aside from the open enrollment, here are a few. This is not all of them, of course. If you lose your current coverage, so when I say loss of current coverage, a lot of times folks think that means that I have to, I have coverage and you took it away, that's it. Actually, retiring from your employer health plan is a part of that as well. So if you leave your employer health plan on your own volition, then that actually counts as loss of current coverage. So that would open up a guarantee issue for you. In addition to that, there's this thing called a trial right. This one, some people get confused on trial right, so I want to address this one, because there's actually 2 trial rights. The first trial right that would open a guarantee issue opportunity is you drop a Medicare supplement plan. In other words, you leave a Medicare supplement plan and you go into a Medicare Advantage plan, and it's your first time in a Medicare Advantage plan. Now that's a key. You got to make sure it's your first time in. You can't have had one 10 years ago, been on Medicare supplement since, and now picking up another one. That wouldn't be your first time. It has to be your first time into a Medicare Advantage plan. If that is your situation, then anytime within the first 12 months of that Medicare Advantage plan, you can utilize what's called your trial right and go right back to your Medicare supplement plan that you had before. No questions asked. You don't have to answer the health questions. You can get right on the plan you had before. If you're in a scenario where the plan you had before is no longer available, then you can actually sign up for any Medicare supplement plan that's sold on the market. Key thing with the trial right is first you have to go back to your existing plan first. If that plan is not available, then you can join any plan on the market. Now, there are always exceptions to these rules. These are the rules that CMS puts in place. Carriers from time to time I've had people call me up and say, well, so-and-so carrier takes people regardless, even if there are other plans still available. That is a carrier decision, and they can do that. However, as far as the rules go that are put out by CMS, this is how the trial right works. And again, all that you can find in that guide that I dropped in the handouts for you. But here's the second trial right that a lot of people forget about when you're talking about Medicare supplements, and that is when you age into Medicare. So when you're first eligible for Medicare, you go into a Medicare Advantage plan. You actually have, from that moment, even though you never had a supplement before, it's your first time in the Medicare program and you join a Medicare Advantage plan right away, you actually also get a trial right to any time within the first 12 months of joining that plan to say, you know what, I don't think this was the right choice for me. I want to go to a Medicare supplement. So then you can to any Medicare supplement plan sold in your area under that trial right. So those are the two trial rights. Again, a lot of people forget about that second one. I get a lot of questions on that all the time, and it's all found right there in that book. Somewhere, again, it's going to be somewhere at page 20, 21, somewhere in there. I can't remember exactly which page it is, and again, they move it around from year to year, but it's always right in that area. So anyway, you can find that in that guide. Some of the other, there's a lot of other reasons that you would end up getting the guarantee issue, but there also are these weird state rules, because again, the federal requirements are what's in the choosing a Medigap guide. States, because it's an insurance product filed with the state insurance department, the various state insurance department can impose additional rules. And for example, the state of Missouri has this thing called an anniversary date open enrollment. And what that means is every year, if you buy a policy in the Medicare supplement policy in the state of Missouri, every year on the anniversary of your policy, then you can switch to another company's like plan. When I say like plan, that's like G to G, N to N, that sort of thing. So you can switch to another like plan from another company, and it's guarantee issue. So that is an example of one of the state-specific rules that are out there. So what I would encourage you to do if you plan on working in various states is reach out to the state, and you can reach out to us, but you could also reach out to the state insurance department. They all have a division called SHIP, the State Health Insurance Assistant Program, that will provide you with those answers. And a lot of times, those states will publish guides with their rules in them. For example, the state of Arkansas has a guide called Bridging the Gaps, and it's essentially the state of Arkansas's Medicare specific rules. So I encourage you, if you're planning on, like some of you like to do I'm going to get my license in XYZ state, and I'm going to work some phone leads and try to sell Medicare supplement in XYZ state. Great. Get with us. Let's make sure, one, that you're appointed in that state, and two, let's make sure you understand the state specific rules. So that's what we're here for, to help you with that. But those are some of the guarantee issue rules. There are a lot. Again, that guide pretty much gives you the majority of them, and then again, carriers from time to time do their own things. But those are the minimum requirements. So if you ever have anybody that meets one of those minimum requirements published in that guide, they get guarantee issue regardless of what the carrier says. Pricing is another thing with Medicare supplements. Again, if you're used to enrolling people mostly into Medicare Advantage plans, pricing is not something you've ever really considered. But when you're selling insurance policies like Medicare supplements, obviously pricing comes into play. And this is another area that can vary from state to state. So this is something that, again, if you plan on branching out into your other markets, something you need to be aware of. There's really kind of two pricing categories. There's a thing called community rating. Community rating is practiced by some states, like for instance Arkansas, and in that, when you have a Medicare supplement product in a community rated state like the state of Arkansas, basically that means that the entire Medicare community in that state has the same rate. So it doesn't matter if you're 65 or 95. A company that offers a Plan G in that state has to offer the same rate for the 65-year-old as they do the 95-year-old. There's pros and cons to that. Obviously, that's very good for that 95-year-old, not so good for the 65-year-old, because typically in that scenario, obviously those rates have to be adjusted to accommodate the entire pool of potential candidates. So those are community rated states. Most states do age rated, and that's just what it means. It's the rates are based on the age. So a 65-year-old has a different rate than a 67-year-old, than a 68-year-old, so forth and so on. So those things are all important when we're going to talk about some of the who buys Medicare supplements here in a little bit and some prospecting. Those things become important because one thing you'll find, and you guys that's done this for any length of time know this, is the insurance buying public, once they purchase a product, if they're happy with it, unless somebody tells them to switch it, they don't. They just keep it. I can't tell you how many times I've come across people that are paying astronomical rates on a supplement plan because it's gone up over the years, or they're in one of these age-rated states and they're in a plan that likes to target the younger ages, and they make it up on the older ages, and so they're paying a high rate, but no one ever told them to move, so they don't. Those folks need help. There's opportunities out there to help those folks. So those are key things to keep in mind when you're thinking about Medicare supplement, where I should try to prospect, who I should look for a Medicare supplement. Obviously, everybody likes to look for turning 65s because those are the easiest. Those are people that have to make a decision and they don't have to answer any health questions. So everybody likes those, but you know, and there's a lot of them. Don't get me wrong. There's 10,000 baby boomers a day aging into Medicare, but they're not 10,000 baby boomers in your community. So in that aspect, we don't need to forget about everyone else that needs help. Talk a little bit about Medicare supplements for under 65. I get these questions all the time. Constantly, I get people calling the office to go, hey, do we have anybody who's on disability Medicare? They're on Medicare because of disability. They're healthy, they just got like a back problem, or they're healthy, they just got whatever. And so I can tell you that, yes, there are some options. However, a couple things to consider. One, most of those options are very, very, very limited because carriers, quite frankly, don't like to write disability Medicare business because it's typically instant claims. And obviously, if you're an insurance carrier and you're putting an insurance product out and you're trying to be competitive in the market space, buying a bunch of instant claims is a recipe for failure. You're not going to stay competitive very long if you're loading up claims and not getting a lot of new fresh premium. So most carriers don't like to operate in that under 65 Medicare space. There are some options available, but they're typically very limited. They're also typically very expensive. More often than not, when I see those, the rate that they charge for the plan that they offer, you'd be better off not having it. So my advice for most agents and most scenarios, if you've got someone on disability Medicare, more often than not, they're probably better off looking at a Medicare Advantage plan. And then when they turn 65, they get all the same rights as everyone else turning 65. So they get an open enrollment period at that point. They can move to a supplemental guarantee issue at that point. But more often than not, under 65 disability, the options available are going to be so expensive that they're probably better off not having it. Always exceptions to the rule. I never speak in absolutes because there is no such thing as an absolute. There are always exceptions to the rule. So we know what a supplement is. We kind of know how they're priced. We know how they work. That part's pretty simple. Now we're going to get into really the meat and potatoes of what today's webinar is about, and that is how you can grow your profits offering these plans, especially if you're not doing it now. Before we can do that, though, we got to know, well, who buys Medicare supplements? Because I've had agents say, well, everybody I come across is Medicare Advantage prospect. Who buys Medicare supplement plans? I think you would be surprised, and that's really what these statistics that I'm about to go into and talk about are kind of eye-opening. And just for your information, the data that I'm going to provide, the statistics that I'm going to provide in this webinar come from two sources. The first source is an organization called the Kaiser Family Foundation. They are, anybody that's familiar with them know that they're a huge research organization that researches a lot of insurance data, and they have a a wealth of insurance data. I encourage you to look them up, Google them, go to their website. You can find a lot of information on market share and all that stuff there. That's what they do. So there's a lot of great data there. The other bit of the data that I'm going to talk about, statistics I'm going to talk about, comes from the Medicare Supplement Association. And that is another association that I encourage you to look into. And if you can just type, MedSup Association, and they'll be the first thing that pops up in Google. That organization it's actually an agent organization that you all can join, and I encourage you to do so, because when you do, you're able to as a they'll have you listed as Medicare supplement agent in your area. So when beneficiaries are searching around for Medicare and they come across that and they look for an agent in their area, your ad will pop up. You build your ad, or you can put your picture on there, your contact information, all that stuff. Pretty neat. I encourage you to be a member of that if you're not. They also hold an annual conference every year that we typically attend, as well as all the big carriers typically attend. That used to be called the Medicare Supplement Conference. It's now called Medicarians. It's kind of a weird name, but that's what they call it now. And essentially, that's a 2 to 3 day conference that's held once a year. I think this year it's in Las Vegas. And agents come, FMOs like ourselves come and present information. Carriers come and present information. There's a trade you can get one-on-one with carriers. So it's pretty neat thing. I encourage you to look into it. And since we're on the subject of associations, I also encourage you to look into your local and state level and other national agent associations, because those are great opportunities to not only get good information, but also get your voice heard when we're talking, when Congress and the government's like starting to make decisions on Medicare, and they start debating rules, just like right now with the proposed Medicare Advantage change rules. Those organizations like NAHU and some of the others have a arm that goes and lobbies on your behalf. So you join those organizations, they have local divisions and state level and national level. And so I encourage you to look into agent organizations if you're not. So not only do you get your voice heard, it's also an opportunity to interact with other agents in your area to learn from them what's working and what's not working. So I encourage you to get involved in those. And I'd be remiss talking about those kind of groups if I didn't say I encourage you also to join our Drennan A-Team Facebook group, because that's also an opportunity to share with one another. So anyway, do all that. I say all that to give you a bunch of statistics. So I kind of got off on a path, but I need you to understand that those organizations are great and they're there for your assistance. But now we're going to get into the statistics. Who buys Medicare supplements? Roughly 25% of the total Medicare market purchase a Medicare supplement. That's a big number. That's a big number. When you start thinking about how many folks are on Medicare now, which is estimated at 63 million, and you think about by 2060, the Kaiser Family organization estimates that there are going to be 90 million people on Medicare. So it's a booming market. We've all talked about the baby boomers for years and years and years. It is an absolutely exploding market. So a lot of folks getting into Medicare, and you should. But unfortunately, a lot of them focus only on one avenue of Medicare, and that's Medicare Advantage. And if you fall into that category, you're ignoring 25% of a market. And that's a big number to ignore. Those numbers look like this. In 2010, that 25% equated to 9.7 million people purchasing Medicare supplements. By 2020, that number had grown to 15 million. And that number continues to grow. And as that Medicare population continues to boom, so does that Medicare supplement share continue to boom. One thing that we've noticed, even during those 10 years from 2010 to 2020 are some of the most explosive Medicare Advantage growth we've ever seen. But Medicare supplement held on to their 25% market share that entire time. That's an important number for you. If you're not currently selling Medicare supplement, you need to be. That is an important number for you. You're, quite frankly, leaving money on the table. And if you're trying to plug everybody into a Medicare Advantage, even if that doesn't really fit what they need and want, then you're trying to shove every square peg into the same round hole, and that's really not what we're in the business of doing. We're in the business of presenting Medicare to folks, explaining how it works, showing them their options, and then helping them make an informed decision. You can't do that if you don't have all the options. So I encourage you to be a part of that. Here's another statistic that may shock you. Of the people that are 65 to 74, so that's the age-in market, and for like the first 9 years of being on Medicare, roughly 52% of those folks buy a Medicare supplement. So what that means is that if all you do is chase T65s and all you offer is Medicare Advantage, then you're losing out on opportunity about half the time. So you need to have an entire portfolio. That 65 to 74 crowd, roughly 50% of them purchase a Medicare supplement. And I can tell you from my own personal experience, we at Drennan do not write business direct. We don't compete with our agents. That's not what we're in the business of doing. Business of assisting independent agents. However, from time to time, because of associations that I'm a member of and church and whatever else, I run across somebody who needs help with Medicare and they just want me to help them because they know me and they trust me. So I've helped a few over the last 5 to 10 years. Used to write a lot of Medicare back in the day, but I don't do that anymore. That's not my role. But I have helped a few over the last few years, and of my experience, it's 50-50, Medicare Advantage, Medicare Supplement. And it really boils down to, some of the things we're going to talk about here next, and that's what they wanted. So when you go explain Medicare to people who value total freedom of choice tend to want a Medicare supplement because they don't want to be told you can have this service but not this service, or you can have this service but you got to go over here to do it. So people who tend to value total freedom of choice, those are Medicare supplement buyers more often than not because it offers that freedom of choice. Now I say more often than not because price is a big factor in it. When people start looking at their Part B premium and a Part D premium and a Medicare supplement premium, Medicare Advantage sometimes starts to look a little bit more attractive. Again, it breaks out about 50-50 on that crowd. Other folks that tend to gravitate toward Medicare supplements are folks that tend to have a little bit more health challenges, concerned about, those co-pays and all that stuff that they'll come across with the Medicare Advantage. A lot of that crowd tends to look more Medicare supplement because, again, it's one premium and that's it. Also, folks that value a predictable budget. Because it's kind of difficult, even though when you look at Medicare Part C, a lot of times it's zero premium or a lot of times it's very low premium. There's co-pays for services. And so it's hard to predict your budget like that. Folks that tend to value that work, this is my ledger, this is my budget, I like to account for every dollar. There are people like that. Then there are people on the other end that, well, I don't worry about it until the end of the month. But regardless of which category there, those folks that tend to value a predictable budget like the idea that with a supplement, I'm going to pay this premium and that's pretty much all I'm going to owe. I mean, there are some additional out-of-pocket costs, but it's predictable. So those folks tend to buy Medicare supplements. So again, this slide and these statistics are really just to tell you that if you're not presently offering supplements, which a lot of you are not, you need to get a hold of us, get contracted with some great products, put this in your portfolio. The beauty of this kind of business is it doesn't cost you anything to contract with the plan, so you might as well have it in your portfolio when you need it. A few more statistics that may surprise you. This statistic right here goes back to what I was talking about earlier about folks that just kind of get on a plan and just stay on it unless somebody tells them otherwise. 57% of folks on a Medicare supplement don't do an annual review. We've gotten a lot better with Medicare Advantage agents of going out and doing an annual review, but a lot of times supplement agents They forget to do that. They just set it and forget it. And they don't do an annual review. And what ends up happening, again, over time, those premiums will creep up, or if they're in one of these age-rated states, over time, again, those rates are going to go up every time they have an anniversary date after their birthday. And some carriers have a better rate for 75-year-olds than others. But if they never have a review, they just think, well, I've got what I need, and they just move on down the road, and they don't understand that there's other opportunities to save them money. Because the beauty of Medicare supplement, and many of you have heard me say this a lot, it's a commodity product. In other words, it's like buying a Chevrolet pickup. It doesn't matter if you go to this dealer or a dealer in another state. It doesn't matter. They all come off the same exact assembly line, same exact truck. The only difference is price and service. It's the same thing with Medicare supplements. All come off the same assembly line. A plan G is a plan G, regardless of who you buy it from. The only difference is price and service. So when those folks don't do that annual review, and they're 5, 6, 7, 8, 10 years down the road on the chances are pretty good that there's a them out there. Just no one told them. So they just keep what they got. That's all good, but opportunities for you as an agent, especially when you have a book of business, is the way Medicare supplement commissions work, is it's typically level for 6, and then it drops off to a 7% or something like that thereafter. As an agent, 3, 4, 5 years down the road, your book of business, typically speaking, the rates have gone up a little bit. New products have entered the market. It's a good opportunity to go back out to those folks and move them to a new plan and start that 6-year clock over again, start their rates at a lower rate. Everyone wins. And then again, when I talk about this, a lot of folks tell me, yeah, but you got to qualify for underwriting. And, people are older, they can't qualify for underwriting. I can tell you right now, the vast majority of the business we submit gets issued. Underwriting is not as scary as you think it is. Now, can I write somebody with active cancer on a Medicare supplement plan that doesn't have a guarantee issue? No. But I can write people that have some health challenges. So there's opportunities there. Reach out to us. Here's another statistic, a couple of statistics that may surprise you. And that's 58% of that market purchase a plan G. That shouldn't be a surprise because that's the most comprehensive plan available right now to folks that it's aged in past January 1st, 2020. But this one shocks a lot of people that don't consider the other plans. 32% are purchasing a plan in. And the reasons for that are simple. If you simply do the math, more often than not, the rates on the in, just even with the additional possible out of pocket, are vastly lower than the G. So if you're not offering an in, if you've never looked at plan in, you need to reach out to us and have that conversation, because it is 32% of those purchasers are going that route. Oh, by the way, a lot of carriers tend to pay a couple of points higher on a plan in than they do on a G. So that's something else to consider. Again, reach out to us. We can help you go through all of that. Here's the top 3 carriers by volume. The first 2 should be no surprise to anyone. UHC AARP is the number 1, followed by Mutual of Omaha and their family of products. Depending on what state you're in, it's called something else, but Mutual of Omaha. But the one that may surprise you is number 3. Number 3 product sold by volume is CVS Health Ascendo. That's a plan that, as an Integrity, we at Integrity rolled out a couple of years ago. I guess it's been a few years now, and it's been awesome in the market space. If you're not contracted with that plan, you need to reach out to us and get contracted with that plan. It is a plan. It's CVS Health Medicare Supplement Plan, which is backed by Aetna. It is a plan you need to have in your portfolio, and it's a number 3 plan sold. So if you don't have it, obviously they're buying it from someone. So get a hold of us and let us help you get contracted with that plan today. So that's who buys the plans. Let's talk about some tools to help you sell more. First and foremost, we've got something called Medicare Center. If you're new to us or maybe on this webinar not quite contracted with Drennan, get a hold of us right now and let us help you get this amazing tool in your hand. Medicare Center is a full service Medicare platform for you. It has a CRM built into it, pretty robust CRM where you can track your client data and what products are on, so forth and so on. You can quote, compare, and enroll Medicare Advantage plans through it. You can do scope of appointments. You can do your required call recording on Medicare Advantage plans through that platform. But more importantly, for the purpose of this call and this webinar, they've got inside of Medicare Center is the CSG quoting platform. Many of you are familiar with that. CSG is an integrity partner now, so it's wrapped up in our Medicare Center. So within your Medicare Center, you can access the CSG quoting platform, and that tool allows you to quote, compare, and enroll Medicare supplement plans, final expense plans, hospital indemnity plans, dental plans, all in one place, So it's an amazing tool. If you're not now, you need to reach out to us because you can store your client data, quote, compare, and enroll them all in one spot. So reach out to us if you're not using that tool and let us help you with that. Another thing we have to help you is we have something called, it's our Turn in 65 prospecting tool. This is another awesome tool that can really help you. It can help you with any Medicare stuff, really geared a lot toward Medicare supplement. What that tool will allow you to do is it'll give you a geographical radius of where you're at right now. Like with my computer sitting here in Inlet Beach, Florida right now, I run the tool and it'll give me a radius around my location, 65 in the next year. It gives me their birth date and their address and their name. That's an amazing bit of information. It's not going to give you their phone number and things like that because they do not call list and so forth and so on. But what you can do with that data is you can mail them a letter expressing that you're a local agent that helps folks with their Medicare and you'd be happy to help them. It's a great tool. Reach out to us. We can show you how to use that. You do need to be contracted with us to use that. So if you're not contracted with us, let's get that part taken care of and then we can help you use that tool. It's an amazing tool. The other thing that we at Drennan bring to you, not only great Medicare supplement plans with United Healthcare and folks like that, but we also have products that through our Integrity platform are exclusive to Integrity partners. And you need to be selling those. And there's a lot of reasons why you need to be contracted with those plans. And if you're not, you need to get a hold of us. One is some of the top names in the industry. We've got exclusive plans with Liberty Bankers. We have a plan with ACE, which is an A++ rated Medicare supplement carrier. Quite frankly, I've never seen that in the market before, an A++ rated carrier. That's amazing. You need to reach out. And not only that, they got great rates. You need to reach out to us on that one for sure. We've got Aflac. I mean, you guys see the Deion Sanders and Coach Saban commercials with the duck. You all have the opportunity to put in your portfolio a national brand that everyone knows with the Aflac duck. It is a Medicare supplement plan that you can offer that's got Aflac's name on it. The materials that you can order from Aflac, will have the duck and all that stuff that people are familiar with. That's a great plan. We've got an amazing plan with Allstate with outstanding discounts on it. You need to definitely reach out to us on that plan. Again, I talked about the CVS Health Ascendo. It's a #3 product sold in the Medicare supplement space. You've got access to that. Depending on which state you are, we've got a product with Lumico. Some states it's called Ellipse, some states it's called a Lumico, same product. We've got an exclusive product with Humana. We've got an exclusive product with Medico. We've got an exclusive product with Manhattan Life. And the beauty is our team in Atlanta is constantly working to bring new products to the market. So amazing opportunity to sell some big name products that you can only get through an Integrity partner like Drennan. So again, if you're not contracted with these plans, reach out to us today and let's get these in your portfolio. These are big names. Some great rates, great commissions, great discounts. We offer top commissions on most all of our, on all of our exclusive plans. Most of them on average are paying 22% to the street. That's level for 6. There are commissions available if you're a manager and you have a team of agents. There are override contracts available for you, but street level agents, 22% on the street, pretty competitive. Almost all of our plans have a bonus incentive program. So, you sell X amount of products, you get the commission plus bonus. Again, we'd be happy to discuss those with you. All of our products offer electronic enrollments with multiple signature options. Cool, because sometimes people with electronic enrollments, I've dealt with you say, I still use paper because I try to use electronic enrollment, but they require an email signature and my client doesn't have an email, or my client it goes to their junk folder, they can never figure it out, so I just use the paper. The beauty of the products that we offer is there'll be multiple options for electronic signatures. You can do email. We've got some that offer question-based signatures where they just call in and they ask you, they answer a question and that constitutes their. We've got some that, a lot of them that do voice signatures, of course. We've got some that do text signatures. Great opportunities there. And our team down in Atlanta is constantly working to come up with new ways to make doing business easier. All of our plans offer great household discounts, and they all of them offer super competitive rates. My team here in the office has a heat map with all of our plans, all of our exclusive products, and they've got a playbook and they can flip through it and find the heat map. So if you say, hey, I want to work in Oklahoma City, Oklahoma, they can quickly scroll and go, okay, in that market, here are my top plans. And then they can go to the CSG tool and then run some comparisons. But real quick, they got a heat map. They can say, in that area, this plan is going to be number 1 for you. So that's what we're here for, to help you with. That's our role at Drennan, is to help you not only understand what all this is, bring tools to help you make it easier for you, but we also have a team of folks that are just here for the sole purpose of being support when you need it. So how do you get started? If you're not offering supplements now, or if you're offering supplements but you're not offering them through us, you need to be offering them through us. And if you're not offering them, you need to be offering them. So how do you get started? Reach out to us today first to get contracting. Absolutely. First things first, contracting. We do one-on-one trainings with you. We can do it if we can get to you reasonably quick. We can come sit down with you one-on-one. We can do face-to-face Zoom chats. We can do telephone calls. We're here for you, how you need it. We can demo those tools that I talked about for you, put you on a Zoom call, share the screen, walk you through how to use that tool, give you control of the screen and help you kind of learn how to use that tool. That's what we're here to do. And of course, prospecting, because all this is great, but you got to have folks to see. So we can help you with leads. We can help you with prospecting through social media. We can help you with grassroots prospecting, seminar prospecting. All those things we've got experience in, and we have existing programs that are working. We can help you with that. Just reach out to us today. There's our email. If you email that inbox, it'll get to the person it needs to get to. Numbers right there. In addition to that, you can call me directly or text me directly. My direct line is 850-855-4179. I'll say that again. It's 850-855-4179, and I can direct you to one of our marketers here that can help you walk through all these tools, or I can even do it myself. So with that being said, again, I like to keep my webinars to an hour. I'm presently sitting at 50 minutes, which is a perfect time to break for questions. So if you have questions, now's the time to pop those out. And let me expand this question box so I can easily see these questions. So one of the questions are about Plan N, and should we be concerned in the years to come about Part B excess, because Plan N doesn't cover Part B excess? No, I'm not personally concerned about it. Is it something that you should consider? Sure. Is it something that you need to make sure that your clients are well aware of when you're presenting the product, absolutely. But I'm not concerned about it personally. And first, let me back up for a second for those who don't know what Part B excess charges are. So if you have a provider that does not accept assignment from Medicare, they're allowed to charge what's called Part B excess, which is essentially up to 15% over and above what the insurance company pays for. On a Plan G, that Part B excess is covered by the insurance company, so it's not a concern. On Plan N, you would be responsible for that, so it could be something that you need to be aware of. Am I personally concerned about it? No, and there's a couple of reasons. One, I can only worry about today right now, and today right now, most doctors accept assignment, so it's not an issue. As we move forward, if that becomes an issue, then quite frankly, then I need to move my folks back to Plan G. But that, again, that's something that we discuss with the client up front and make them aware of. And again, it's not for us to decide, hey, you need Plan N or hey, you need Plan G. It's for us to explain these plans to them, explain how they work, and then let them make a decision. All right, that's really all the questions I have other than the sound issues that I had up front that I had to fix real quick. So if you have any additional questions, right now is the time to type those in, or if you would prefer to just reach out to us separately, do so. I'll give it a couple minutes while I do a little wrap up. Yeah, but if no other questions, I'll wrap it up. Again, you need to be selling Medicare supplements. Statistics show that the folks are buying it. If you're not selling it, we're here to help you with that. Reach out to us today and get contracted with these plans we talked about. I can guarantee you that if you're not working with one of our exclusive plans, we have one in your market that's got a better rate than the plan you're working with, because that's what our team in Atlanta does. They roll these plans out and they roll them out to be right there at the top of the market space where they're at. So you need to do that. Okay. And then the last thing, of course, and I got another question popped in. I'll jump on there and answer that. The last thing, of course, is just hope you guys were able to take something away from this. Reach out to us today and let us help you with that. Another question just popped in. Is there time outside of the AEP for customers to change to supplements? Okay, I want to make sure that we understand here when we're talking about supplements, again, supplements versus Medicare Advantage. Medicare Advantage is a part of Medicare, and because of that, there's windows of time that you can enroll or not enroll. With a Medicare supplement, we're talking about an insurance policy that you can purchase anytime. There's not a window of time. Now, if you're in a Medicare Advantage plan, obviously you cannot leave that plan unless you're in one of those time frames, unless of course you have trial right or something else. But as far as just purchasing a Medicare supplement, you can purchase a Medicare supplement anytime during the year. You do have to answer health questions unless you qualify for either open enrollment or one of the guarantee issues. So if you're still confused on that, give us a call and let us explain that more for you. But again, there's not really a time that's where you can enroll in a supplement. You can purchase a Medicare supplement anytime. There is a time where you can enroll in Part C or D. So that could become important. All right, I don't have any more questions right now. I kept our webinar to 55. Is perfect time. You guys enjoy the rest of your day, and anything else that comes up, let me know, and we will help you with that immediately. Don't forget to if you don't have a copy of that book, pretty much everything you want to know about Medicare supplements in there, and you guys have a great rest of